do a quick neuro outpatient assessment. Okay, so hi, I'm Heather. I'm a critical care nurse getting my master's in nurse anesthesia. Can you tell me your name and date of birth?
Hi, my name is Arnold Zabo, date of birth April 12th, 1982.
Okay, perfect. Okay, Arnold, so I know you have some neuro history from the past. So basically I'm just going to ask you a couple questions, do a quick assessment. So my first question is who's the president? Do you know who the president is?
Barack Hussein Obama.
Awesome, okay. And now I'm going to ask you a little bit about your medical history. Do you have a history of any strokes or mini strokes?
I believe I had a stroke a few years ago.
Okay. What about any paralysis?
No real residual weakness.
Okay. And what about any seizures?
I think they told me I had a seizure a few years ago as well.
Okay, perfect. Any back surgeries or anything like that?
No back surgeries, no.
Okay. So then I wanted to ask you, so you said your stroke was 6 years ago, so that would have been 2010.
Yeah, around
right?
there.
Okay, and did they tell you if it was a clot or a bleed in your brain?
I believe they said it was a clot.
Okay. All right, awesome. So it seems like you're doing pretty well because you walked in here today and you're obviously communicating with me. Great. So
I'll work out.
That's awesome. Good. Awesome. So now I'm going to just kind of go ahead and start my assessment. So I'm going to go ahead and check your pupils real quick. Bright light in your eyes. Okay.
It's my seeing eye cat.
So basically, okay, now I'm going to ask you to basically close your eyes and just tell me if I'm touching you on your left or your right.
Left, right, left, right.
Okay, Arnold, great job. You can open your eyes now. And now this one's like even stranger, but you may have had this done when you were having your stroke. So basically, I'm going to ask you to touch your nose and then touch my finger, okay? So touch your nose, touch my finger, touch your nose, touch my finger, nose. All right. Sorry, that actually was my fault, not yours. Good job, Arnold. That's awesome. Okay, so now basically, I'm going to ask you to just raise your arms up against pressure. Great. And then raise your legs up. Awesome. Great job. You have really good strength there.
Thank you, Heather.
Okay, now I was going to ask you about your seizures. So when did you say your last seizure was?
Probably a few years ago.
Okay. And are you taking any meds with the seizure?
They gave me this med called Dilantin.
Okay. And have you ever been intubated for your seizures? Did you ever have seizures that basically couldn't stop and they had to actually put a breathing tube down your throat?
No, they said they gave me some medicine and just made sure I didn't throw up in my mouth.
Okay, all right, awesome. So now, Arnold, since you're taking that Dilantin med, I kind of want to look in your mouth a little bit. Just checking for how his dentition is and his gums. Going to look at those, smile for me, great. And then stick out your tongue, say ah. Okay, awesome, Arnold, thank you. So basically now I would check his level, his Dilantin level, and just make sure that's within normal limits. Arnold, you're going to get your blood drawn today, just to make sure that your Dilantin level's okay and that you're what we call therapeutic, basically, and make sure that you're good with your meds. Now, it's important to note that this is what we would do on an outpatient. It's like, sorry. It's important to note that we're doing this on an outpatient, so it's really, really fast. If you're doing an inpatient, you're basically going to need to go into more detail. You're going to need to do your cranial nerves, probably an NIH stroke scale, things of that nature, and it's going to be basically a more thorough assessment. And so basically, then I want to talk about the GCS or Glasgow Coma Scale. So basically, that's rated with I at best is a 4, verbal is a 5, and motor is the best is a 6. And so basically that's one of the most important neuro assessments you could possibly do. So even a tree, something that I learned back when I was a new grad was even a tree is a 3. So if somebody tells you that the patient has a GCS of 0, that's very, very inaccurate and they probably need to go back to school. So just keep that in mind. And then another thing is that less than an 8 is intubate. So that's another important thing to remember as an anesthesia provider as well. And then another thing that people get confused on is with the motor, the best is obviously a 6, but people usually get confused on a 4 versus a 5. So basically a 5 is when you pinch the patient and they actually will reach over and be like, you know, get away from my arm. They'll actually feel the pain. And a 4 is when you pinch the patient and they'll actually withdraw from the pain. And just wanted to let you guys know that because a lot of people, like even experienced nurses, will get confused on a 4 versus a 5 on the motor scale. And other than that, that's it, guys. Thank you for bearing with us. This is Bandit, and this is Murphy. And good night, America!